Community-based organizations have come together to roll out counseling services targeting heads of households, particularly men within low-income settlements in Nakuru. One of the directors says in the past decade, cases of suicide in the country have risen at an alarming rate of 58%, with data showing that more men are likely to die through suicide than women. Speaking in Nakuru, the executive director observed that to effectively tackle mental health issues, men need to be encouraged to talk freely about their feelings.
Like now one has to maybe to remain at home, or both of them are at home and there is no income. And you find that now they have started blaming each other. And we have realized there is a lot of intimate partner violence that is on the rise. We find that when a man is stressed, he projects his stress to the children and to the wife. Last week, Health Cabinet Secretary Mutahi Kagwe revealed that 1 in every 10 Kenyans suffer from a mental disorder. He also expressed concerns over the rising cases of suicide. Now that schools have closed down, there is a lot of, the budgets are high in the house. And one thing, they are not even affording those budgets. And so even the kids are stressed. And actually there is also a lot of uncertainty and the children are anxious. Frederick Onyango Osedo, a survivor of depression who is undergoing counseling, says most men have been left alone and are battling difficult situations that lead to depression and in some extreme cases, suicide.
Before she went and she was almost going mad because she was under stress. She was wondering, now what are we going to do under this situation? The children are here crying, they're asking for food, there's no one to help. Even though she had some income, she was doing some little business, but that business was not enough. So she was so much disturbed to the extent that I'd not be having peace in my family.
Another community-based organization director, Zipora Nyangara, says she is working with 300 individuals in tackling mental health problems in the populous free area slums on the outskirts of Nakuru town.
There has been an increase also of gender-based violence, especially the intimate partner violence. School was a safe space for them, but now when you're coming home, you're living with relatives or just living with your own parents, but because they have their own issues, the gender-based violence goes up to them. So basically, and we are emphasizing that for a woman, they also have a space.
Rathia Suleiman, also a beneficiary of the counseling program, observed that men are suffering because people have been impatient in looking beyond the surface and find out why individuals behave the way they do.
Vile walikuwa wamezoea vibarua hakuna, wengine wameenda kuwa kwa pipa, wengine wameenda shughuli zenye hazifai, wengine ni wajawazito, watoto, wasichana, wengine walienda kuolewa kwa sababu ya maisha vile imekuwa ngumu. Wazazi wengine wanaambia watoto waende wajitafutie vibarua na watoto wajue kwenye watatafuta vibarua, inabidi mtu ameingilia shughuli chafu, shughuli za kwenda msichana ameamua kwenda kuolewa. Vijana wengine hata saizi ni wabaya, wanaamua hao wanaenda kutafuta nini? Sweet mama na.
Her sentiments were echoed by Elizabeth Wanjiko, who said the society should position itself as an ally in men's mental health, adding that a change of attitude will help win this battle.
Na jirani yako anapitia violence, kupigwa na mzee, kama kuna mtoto pia anapitia the same thing. Tumefunzwa leo ni vizuri unaripoti, si vizuri kujiangalilia tu mabaya kitendeka.
Wanjiko encouraged men who are victims of gender-based violence to report to the authorities and seek counseling services. The World Health Organization estimates that over 300 million people are affected by the condition, which is linked to the suicides of over 800,000 people each year. Suicide is the second leading cause of death among the youth in the 15 to 29 age bracket. 2 years ago, Kenya was ranked 6th with the highest number of depression cases among African countries by a WHO report.